Well, many terminally ill patients are told to get their affairs in order when doctors say there are no options left. But a growing movement says there may still be plenty of medicines that have not yet been approved. Patricia Villone in Annapolis with more on this issue.
You may have heard of right to die laws, but there's a growing movement called right to try.
Right to try basically says you have a terminally ill patient and they don't have a cure. So it allows somebody to use experimental drugs that are still going through the test phase, and it's past safety, and it allows them that right to use a drug to help them find a cure. For right to die, it's basically a patient who has given up and said, I can't do it anymore, I just want to die, and the drug is administered to them to help them die.
Right to try laws are already in 24 states, including Virginia. At least a dozen other states are currently considering legislation. Frank Burrows said the proposed law could have helped his late daughter.
Almost 15 years ago, I started the Abigail Alliance for Better Access to Developmental Drugs after my daughter died when she couldn't get into a clinical trial for a drug that was showing promise for her type of cancer.
So this bill would allow us to have the access. What it does, it gives the right back to the patient, and it's informed consent, so they know what's happening, they know the situation, the best, worst scenarios, what could possibly happen, and then it's left up to the patient to make that choice if they want to try those drugs, opposed to the government saying, even though you don't have any cure, we're not going to let you try it.
Now, the bill SB 63 is currently before the Senate Finance Committee. Similar legislation is before the House Health Committee. From Annapolis, I'm Patricia Villone, CTV News.
And the Goldwater Institute is leading the national bipartisan effort to give terminally ill Americans access to investigational medicines.